Take a look at this picture. It's a picture of a child who is malnourished. The first 1,000 days of a child's growth present a unique window for preventing undernutrition. An estimated 2 million children living in Nigeria suffer from severe acute malnutrition, and that's by UNICEF. So I had an encounter with a mother who brought her child lifeless to the clinic, and she was explaining how the child for some weeks now have been vomiting, had been stooling, she was not eating properly, and she was given the child ORS at home. And when she discovered that the child was not breathing well, she had to rush to the hospital. And when she came to the hospital, unfortunately, it was already too late. And the doctor had to, the child was diagnosed of severe acute malnutrition. Just by looking at the child, you would actually know that the child had, the child was severely malnourished. And I was thinking to myself, why would a mom or a mother wait for so long, or wait for her child's case to be this critical before coming to the hospital? Well, I was just thinking maybe it might be lack of knowledge, or she felt that what she was doing was going to be enough. But sometimes I don't feel just using your knowledge alone is okay. That's why you have people who are more experienced in this field. Let's talk a little bit about undernutrition. Undernutrition is a specific type of malnutrition that is caused by deficiency of essential nutrients or food that are high in calorie or both. What's malnutrition? Malnutrition is a deficiency or excess nutrient intake. So just to summarize it, malnutrition can be undernutrition or overweight and obesity. So I've talked about obesity before, so you can refer back to my previous video to know more about obesity or overweight. But our focus today is undernutrition. There are some physical signs that can help you to know a child who is malnourished. The first sign is a child that is shorter than its average age. For example, if you see a 2-year-old child, you should be able to estimate that this child is actually 2-year-old. But if you see that child, the child I'm looking like 1 year or a few months old. Another thing again is a child not getting height as expected, a child not getting weight as expected. Another sign is a pale skin, looking so dehydrated. Another sign is swelling in the feet, ankle, or even in the abdomen. That is a potential sign of deficiency of protein. Another sign that you can look out for is a child getting sick more often than usual, and it also takes long for the child to recover from the illness. So what's the way forward? The way forward that Dr. Uncle is recommending that you don't wait for the dying minute or the last minute before you bring your child to see a health professional. Another thing again that we recommend is try your best to give that child a healthy, balanced diet. That will go a long way helping. And don't forget, staying hydrated, giving that child water. It would also help the child to prevent undernutrition. Don't forget to like, share, and subscribe. Someone will learn something from this video.